Good evening, everyone. So, my next topic of discussion, which I'm going to discuss with you, is on drug adherence. And this is the under the CBME pattern, which is included in 5.3 PH, drug adherence, that is adherence to the medicine. And now, before I start my video, I want to request you, if this video appears useful to you and if it is helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you drug adherence. Now, introduction. Drug compliance is an extent to which the patient's behavior matches the prescriber's recommendations, and in other words, patient's adherence to drug treatment. Means what is the drug compliance? It is the how the patient behavior, how is the patient behavior for the prescriber's recommendations. Means what is the patient's behavior? Means the prescriber gives some instructions to the patient to take the medication regularly. That is, what is the dosage form of the tablet, what is the dosage schedule, what is the duration of treatment, what all are other non-pharmacological treatment, like other instructions given by the doctor. Means what is the patient's behavior which matches the prescriber's recommendations. That is drug compliance. And although the compliance is used in medical and pharmaceutical literature, adherence has been preferred over compliance. Why? Because compliance means that there is blame on the part of the patient. Compliance means there is some fault or blame on the part of the patient. But in adherence, the patient is free to decide. Patient is free to decide whether to follow the prescriber's recommendations or not. And the failure to do so will not lay any blame or fault on the patient. With the failure to do about the patient's recommendations, prescriber's recommendations, to abide by the prescriber's recommendations will not lay any blame on the part of the patient. That is adherence. That is drug adherence. Means patient is free will to decide. Like in some side effects appears, the patient stops taking the drugs. Like in pregnancy and lactation, if any teratogenic drug is prescribed, the patient is free will. Patient has a free will to stop the drug. Means in these conditions, there is free will is there on the part of the patient. So this is known as drug adherence, and compliance is when there is blame or fault on the part of the patient is there. That is compliance. Now, it refers to how much extent the patient follows the instructions regarding medication given to him by the clinical practitioner or healthcare worker. Means by how much the patient he fulfills these instructions given by the doctor, by the practitioner, by the clinical practitioner or healthcare worker. Means all instructions are abided by the patient or not. It also denotes how much a patient's behavior coincides with the medical advice. The importance. The ultimate aim of the drug therapy is to improve the symptomatology. Means the patient is prescribed the drug and the prescriber has to see that the symptoms and the signs of the disease have been improved or that there is cure of the disease. So the doctor instructs the patient to take the drug regularly. This compliance has to be met. And this is relevant in case of certain diseases, like in life-threatening diseases like HIV, cancer, stroke. The patient has to look for that the drug compliance is met. Otherwise, it will affect the life expectancy of the individual. Means if the patient is not taking the drug regularly, in case of HIV, cancer, or stroke, that can not be that cannot extend the life expectancy of the individual. The effect will be on the life expectancy of the individual if the patient doesn't take the drug regularly. And drug compliance has also been shown to reduce the mortality in patients with organ transplantation. In patients with organ transplantation also, it has known to reduce the mortality. Drug compliance. Variations in drug compliance, like patients follows the prescribed drug as per schedule depending upon the illness he or she is suffering from. Like if there will be chronic disease, the patient may be not so much compliant. And if there will be acute disease, the patient will be better compliant. Because in acute diseases, the drug therapy is required for 5 to 10 days, like in sore throat or in any fever. So drug is the acute disease, the drug therapy is given for a lesser period of time and the patient is more compliant. While in chronic diseases, the patient is on lifelong treatment. So like in hypertension, in diabetes mellitus, and coronary artery disease, the patient is on lifelong treatment. So that can lead to a decrease in the compliance. Means whenever there is improve in the symptoms of the diseases, the patient will stop taking the medicine. And that can lead to many complications. Like in diabetes, it can lead to viscosity of the blood vessels, and it can lead to neuropathy, nephropathy, retinopathy. And in the hypertension also, there can be various side effects can come, and organ damage can occur. So, of the various examples are like when a patient is motivated to lose weight or smoking, it has been seen that compliance is less than 10%. Now, if the patient is on drugs which cause weight gain, and the patient is motivated to lose the weight, or smoking, so compliance is less than 10%. And the better compliance is seen with acute diseases as compared to chronic disease like hypertension. And even compliance is remarkably high in individuals in clinical trials. Now, those individuals who are in clinical trials, the subjects or the participants of the study who are in the clinical trials, the investigator looks to it that they take the medication regularly, the subjects, like either a test drug or a standard drug, whatever they are taking, they take the medication regularly. So the compliance may vary from 43 to 78%. Now, what are the consequences of poor compliance? It will be that there will be more hospital admissions. If the patient is not taking the drug regularly, that can lead to worsening of the condition of the patient, that will be leading to more hospital admissions. And there can be also economic burden on the part of the patient. If they are not taking the drug regularly, that can lead to worsening of the disease. So that can lead to more economic burden on the part of the patient, and that can lead to death also. And good adherence to drug therapy is associated with positive health outcome. Now, good adherence will be the associated with good or the positive health outcome. And adherence to drug therapy may be a surrogate marker for overall health behavior. Now, adherence to drug therapy is the surrogate marker for the overall health behavior. The factors contributing to non-compliance. What are the factors? First of all, socioeconomic factors. This will be if the patient will be less practical, he will take less drugs and he will be less compliant. If the patient will be more practical, he will be taking more drugs regularly and he will be more compliant. Emotionally, if the patient is emotional support is less, so he will be less compliant. If the emotional support is more, so he will be more compliant. Social support also, if the social support is more, the patient will be more compliant. If the social support is less, it will be less compliant. If any conflict has occurred in the family, that can lead to less compliance. Marital status, married people are more compliant as compared to single ones. Gender, like females who are suffering from depression, they're more compliant than the males. Personality means, but if they are not suffering from any anxiety, depression, or any personality disorder, that will lead to more compliance. And if they are suffering from some diseases, such kind of diseases, so they will be less compliant. And patient related means there can be lack of motivation among the patients, like low self-efficacy. There can be low self-efficacy, there can be lack of patient motivation in the patients, and there can be substance abuse among the patients, and there can be guilt, embarrassment about their inability to manage an overwhelming complex drug regimen. Because there can be guilt, embarrassment among them that they're not taking the drug regularly with this over complex regimen, they're not taking the drug regularly. And there can be financial conditions also, the patient can lead to less compliance. Financial conditions of the patient can also lead to less compliance. Condition related or therapy related means if the acute condition is there, the patient will be more compliant. If the patient is chronically affected, the patient will be less compliant, because of lifelong treatment, they have to take the lifelong treatment in the chronic diseases, that will lead to less compliance. Provider patient healthcare system is if the provider is not reinforcing, he is not motivating the patient to take the drug, that can lead to less compliance. If there is not reinforcing the patient to take the drug, this provider, so that can lead to less compliance. Concerns about potential adverse drug effects. Now, there can be various adverse drug effects potential, so that can lead to less compliance, potential adverse drug reactions, because the patient will be suffering from these harmful effects, and the patient thinks that I should stop taking the medication. Patient believes, sometimes the patient believes that I have been taking this medication for a long period of time and now my symptoms have improved, so I should stop taking this drug. Depression and anxiety. Sometimes the patient is suffering from depression and anxiety that will lead to non-compliance or less compliance. Now, how can we measure the non-compliance? Like original prescription not followed. This is the patient can, the doctor can ask the patient that whether you were following the original prescription or not. So that can be that whether he was taking the drugs regularly, pill count has been done, or original prescription pattern was followed or not. Refills not obtained if the after taking the drugs from the dispenser or the pharmacist, the refills of the drugs are not obtained. Means again the patient is not coming to the dispenser or pharmacist for the drugs, like in the like in container drugs in the containers they are not being taken, or the tablet sachet or capsule sachets they are not being taken. Suboptimal dosing, like they can be suboptimal dosing. Now, methods to improve compliance. How can we improve the compliance? Like direct measurement is we can directly access in the body fluids, like we can see in the body fluids like in the blood, plasma, urine, semen. And indirect measurement means we can question the patient that whether you were taking the drug regularly or not. If not, then why, and whether the pill count has to be done, that how much for how many days you have been taking the drugs and how many pills have been taken, how many pills have been left. And they can be directly observed therapy, like in the nurses in the leprosy and tuberculosis, the nurses they do the direct observed therapy of the patients to for the supervening drug intake. So that can lead to more compliance of the patient. We can also detect the tracer. Like tracer is the inert substance which is chemically unreactive, which when given in the body, it will attach to the drug particle and we can trace the presence of the drug particle in the body. Like they can be bromide or phenobarbital or nitrobenzene or azobenzene. These are the traces which we can use. And we can also assay the drug in the biological fluid. And we also can measure the medicine or metabolite in blood, means how much medicine is there in the blood and how much is the metabolite in the blood present. And we can also measure the biological marker in the blood. And we can do the automatic recoding of the daily activities, means how many times the drug has been opened, the drug container has been opened, how many times it has been closed, what was the time gap between the opening and closing of the container, of the lid of the container, and how many times the canister has been pushed for taking the medication. This recoding can be done by of the daily activities. And then we can also know the rate of prescription refills, means what is the rate, means how many times the prescription refills has been done by the pharmacist or the dispenser. And then we can also look for the clinical response, means what is the fasting plasma glucose levels, HbA1c levels, or postprandial levels in case of diabetes mellitus. What are the regular levels coming, whether the clinical therapeutic response has been met or not. Like in hypertension, what is the systolic blood pressure, what is the diastolic blood pressure, whether the clinical response has been met or not. Now, electronic medication monitors, just like how we can know the opening and closing of the lid of the containers containing the pills, and how many times the canister has been pushed, how many times it has been remained open, how many we can calculate it. Patient diaries, and we can also know the physiological markers, like we give the beta blockers in the case of tachycardia in the patients, and so we can know how much is the heart rate of the patient, means how much decrease in heart rate has occurred, because if it is according to the drug taken or not. Simultaneous use of these procedures, or we can use these procedures simultaneously, regularly, as and when required. Now, methods to enhance drug compliance. What are the methods to enhance drug compliance? These can be, we have to do the better and improved communication skills. There should be better and improved communication skills between the physician and patient, and which emphasize on value of regimen and effect of adherence. Means the regimen which the prescriber has given to the patient, means what is the regimen, what was the value of that regimen, and also what is the effect of the adherence on the patient. That should, for that the proper communication has to be done. Means that this is the for this regimen has to be followed properly. Only then the treatment or the effect of treatment will come. The patient doctor has to motivate or to properly communicate the patient to the patient about it. And then we have to motivate also about the patient should provide, the doctor should provide motivation of use of a medication taking system. He should motivate the patient to take the drugs. And for short-term treatments, reminder packages like calendar packs are to be provided. Calendar packs has to be provided, and the patient doctor should give the simple and clear instructions about the regimen as much as possible. Simply and clearly, the doctor should explain that this regimen has to be taken like this drug has to be taken in the morning, this in the evening, this in the afternoon, and this in the night. This, clearly, the drug regimen has to be explained to the patient. And evaluate any lacunae in poor adherence. Means if there is any lacunae in the any side effect or any deficiency in the poor adherence is there, like if patient has missed the appointment, like if the patient has missed the appointment, or if there is lack of response, then we have to evaluate the deficiency. And then the doctor should tell the patient that you should not miss for the appointment, and there should be no lack of the response should come. You should not miss the appointment. That should be evaluated by the patient, by the doctor, and it should be told to the patient that you should come for the follow-up regularly, and so that there is no decrease in the clinical response of the drug in your body. And then the patient has to be listened by the doctor if there is any problem in the drug regimen or any cost wise. If the patient is suffering problem that the drug is very costly, then the patient has to tell about that to the doctor that my drug is very costly, I cannot take this drug, I cannot afford this medication. The doctor has this responsibility to alternatively use the drug which is less costly and more efficacious. And then we can use alternate medication regimens, like medication with long half-lives. Like in chronic diseases like hypertension, diabetes, we can use extended spectrum, extended release preparations, sustained release preparations, closed controlled release preparations can be given, which can be given once daily dosing. And then they have a effect for the whole day, so that the compliance is improved. Or the transdermal medications can be given in case of the acute attack of angina, so this can lead to improved compliance. Now, what is the conclusion? It is compliance adherence is necessary and important for a successful treatment outcome for a patient. Now, it has been seen that it has to be necessary for the successful treatment outcome of the patient. And compliance should be met in all forms, like drug dosage, means whether it was tablet, injection, capsule, whatever was prescribed, inhaler was prescribed, that should be met. And what is the time interval of taking the medication, whether it was OD, BD, TDS, SOS, and duration of treatment is necessary. And it should be very much monitored in patients with geriatric and chronic disease patients, like chronic disease patients like hypertension, diabetes, CAD, and in geriatric patients who are suffering from a lot of number of diseases. So in them, the compliance has to be met regularly. So that has to be seen. Otherwise, the complications can come and that can worsen the disease of the patient. And also in life-threatening conditions like HIV, cancer, and stroke, that can affect the expectancy, the life expectancy of the patient if the patient is not taking the drug regularly. So that is, the compliance has to be seen very much thoroughly in these cases. And it can be improved by education to the patients and caregivers. We can improve it by educating to the patients. We can give the education to the patients and caregivers, and self-motivation. We can also give the self-motivation. The patient should be self-motivated, and routinely follow-up has to be done so that the compliance is met. We routinely follow up the patient. The doctor will look to the prescription refills, whether the prescription was taken by the drug regularly or not. So routinely follow-up has to be done. So that's all for the drug adherence or drug compliance. I hope you understood my video. If you like this video, kindly subscribe to my YouTube channel. This is Dr. Nitika, Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed, be safe. Thank you. Happy learning. Thank you.